My name's Michael Valenzuela, and I'm the scientific founder of Skin to Neuron. Skin to Neuron is a fairly new biotech company founded in 2019, and our mission is to really change the game in Alzheimer's disease, to introduce an all-new type of therapy. It's a cell therapy, so we're the only company in the world that's attempting to replace the lost neurons or brain cells in Alzheimer's disease, so that in the future, patients that receive this treatment will recover their cognitive function and basically introduce a new concept to medicine, which is called dementia remission, going back from dementia back to normal cognition. So that's what our company's overall ambition is. We hope to start clinical trial late next year, and over the next few years actually put this idea that's been under development for more than 20 years to the test. Dementia Australia estimates there are about 440,000 people with dementia right now, and every year there's approximately a new 80,000 people, so a few hundred every day get diagnosed with dementia. We're at a really exciting phase of our development journey. This has been going for about 20 years. It started in academia at University of New South Wales, where I was really interested in the idea of generating neural precursors, or almost like neural stem cells, from skin tissue, which had just been kind of discovered by various groups around the world. I was at the same time, keen to work out, is there a better model to test this idea of neural replacement, which is about replacing the lost neurons in Alzheimer's disease with new neurons. And so a chance conversation with the vet of my pet dog at the time, he told me, did you know that dogs get Alzheimer's as well? And that kind of floored me, because I'd been doing research in the area for a number of years and no one had mentioned this idea that dogs naturally get Alzheimer's disease. So that kind of snowballed and became a whole research program defining and understanding this phenomena of Alzheimer's in dogs. And that all came together around 2017, where we did a veterinary trial in dogs with Alzheimer's disease. And we got some skin from their abdomen, and we generated these neuroprecursors from the skin using a new process that my team had discovered along the way. And then with a neurosurgeon, a human neurosurgeon, we injected those cells into the hippocampus, or the memory center, using brain scan or MRI guidance. And that trial was the first of its kind and was very successful. In 4 out of the 5 dogs, they improved enormously. And in 3 out of the 5 dogs, we achieved what we call dementia remission. So they got back to normal. And some of the owners said, like, wow, I've got my beloved pet back to their normal behavior. So that was really a kind of pivotal moment that made it real, not just for me, but for funders. And I met Bill Manos, who's the angel investor behind Skin to Neuron, and we founded the company on the back of the veterinary trial. And so since then, so that trial finished around 2019, since then we've actually been developing the cell technology to the point where we could treat a person. And we're at a kind of key inflection point right now on that journey, where those cells are not only being made by us now, we're teaching or transferring how to manufacture those cells to a third party, a commercial party, so that they will be so-called clinical grade cells for the treatment of Alzheimer's disease in a future trial. So that's happening right now, and it's kind of the last of the major milestones before we can get into trial. And this is really putting this 20-year journey to the test, which is an incredibly thrilling moment for me. It's been a very big transition going from academia and medical research to founding a biotech company, and really transitioning from pure science to development and commercialization of a technology. So there's a huge mental change and process change in the way you approach science, but it's still science. And it's really about a lot more quality and rigor around the things you do, so that you can confidently start the trial and know that your, for example, manufactured technology is going to work every time that you propose to treat someone. So at the same time, a biotech company needs money. And so that's been a massive learning curve on how to go about funding a new biotech company. It's very, very challenging, and I've learned a lot along the way. The next 12 months are incredibly exciting because it's all coming together. We have the funds to be able to launch the trial. We'll be applying for human ethics approval to be able to commence the trial. The trial will be in Melbourne, so we have a manufacture facility and imaging and neurology partners in Melbourne. And so that's going to really be the culmination of what is really the first phase of Skin to Neuron, which is moving from preclinical to clinical stage company. So the next few years are going to be about execution of that trial, exploring other potential indications where our technology could be helpful, and this ongoing process of fundraising and really getting Skin to Neuron out into the eyes and ears of the public, because we've been in kind of quasi-stealth mode to date, and now it's really time to start engaging and letting clinicians, scientists and the general public know about what we're doing. That's the next few years. During all of that time, we're still in research and development mode, and so not only is funding from investors important, but the support we've been getting from the Australian government through the R&D tax incentive has been critical to get here, to so-called cross that valley of death. But we're still in research and development mode because we've got to do a trial and we've got to expand the type of diseases that we could treat. And so that ongoing support is really critical. It's very topical right now. And all I would say is that it's been absolutely key to getting to this point. And the biotech sector has all sorts of challenges. And one of the particular ones is the long range, I guess, timeline that we undergo. Because as most people know, or maybe they don't know, but a new medicine takes 15 to 20 years to get from discovery to actually on the market. So it's a very long journey. And so we need that partnership, that commitment and support all along the way. It's really very important.